are now tuned in to this week's episode of our podcast. Today, we are going to interview some of the greatest and most influential minds in our field. By sharing our collective expertise, we will show you how to harness, control, and use your own skill set to achieve ultimate success and live the life you want. And now, please.
Good to have you on the show once again. This is Omobola Stephen, your host on Live Only to Omobola Stephen. Remember, the podcast focuses on self-improvement and personal development, which focuses on topics under this personal development and also self-improvement, occasioning expert and professionals who are adept in this service. Also, I'd like to let the audience know that personal development is a lifelong process that we must all embrace in life in order to be who we're truly meant to be. Today, I have Sherman, who is a board-certified pediatrician, a master certified physician development coach, and consultant. Hi, Joe. Welcome to the show.
Thank you. Thank you so much for having me.
Thank you for joining me on the show, Joe. We'll be talking about physician burnout and the impact on patients. Such a great topic for discussion for such time as these. Joe, I'd like to start with this question. Why do physicians or healthcare professionals, why do they experience burnout in their job?
Well, this is something that has been an issue for quite some time, even before the COVID pandemic existed. As healthcare has become increasingly complex and more corporatized and more of a business, physicians have found themselves becoming more of an employee within a corporation, as opposed to people that are in relationship with patients and have some autonomy and engagement in how they would like to participate in the treatment and healing of their patients. So as medicine gradually has become more complex, more corporatized, and more business-like, as well as technology expanding so that we're now using computers, electronic health records, all of these things. This has created more administrative work for physicians as opposed to actual patient interaction and treatment. And so much of our work as physicians now, some people believe, and there's been studies to show, that for every hour of patient care, there's 2 hours of administrative work that physicians have to do. So it's causing us to be drawn away from that patient-physician interaction and that relationship, and more involved with work that we never anticipated doing when we were in our medical training.
Oh, right. Joe, you have delivered quality healthcare to undeserved children and families, and you've also experienced episodes of profound burnout, which has necessitated you leaving medicine temporarily. Can you just tell us a bit, what were the underlying issues that prompted this?
Well, classic burnout, as it's defined in any profession, it's actually now considered to be a psychiatric diagnosis. Not so much that it means that you have a psychiatric disorder, but it's a condition that we experience. And what it is a combination of emotional exhaustion, a sense of depersonalization, meaning that you become emotionally exhausted. So now you feel kind of separated from the other person that you're trying to serve. It's almost like you're going through the motions without really being consciously connected to the other person. And then there's also this sense of no accomplishment. It's like you're not really achieving anything. You're not getting anywhere through this process. So with the emotional exhaustion, depersonalization, and a sense of a lack of any type of impact or success or improvement, then this leads to a feeling that you're just burned out. It's the best way to think about it is that we have emotional, physical, spiritual tanks that we fill up through different practices. And then we give from those tanks to other people through our work, through our daily lives. And we must fill up those tanks some other way that we choose to do or that we found helpful. And so for me personally, what happened was at different stages, I would say, along in my career, I was confused about whether I was burned out or whether I was just misplaced. Because sometimes as physicians, if we're in the wrong work environment that helps us to thrive and to be our best authentic selves, then we end up getting burned out because we're kind of forcing ourselves to do something that's not natural for us. So for me, this came when I returned from living in Bolivia with my family, and we lived there for 4 years. And during that time, I worked as a pediatrician. I taught, I did community development. I accompanied other people who were visiting Bolivia from the US, almost like a cultural ambassador. And I experienced all of these things that bring me life. And then I returned to the US and I started to work as a pediatrician in a clinic where the staff had been cut in half because of economic constraints of the organization. And so we were forced to do the work that they had done in the past before I got there, but with half the support staff. And I, being a physician, wanted to make up for that deficiency by working harder and trying to help everyone to feel supported and successful. And in the process of doing that, I started to go downhill because all of my tanks were being emptied, emotional, physical, spiritual. And I really spent all of my time working or worrying about trying to make things work for the patients as well as the staff working around me. And then this eventually led to me being anxious and depressed and really having to leave altogether.
Right now, talking about misplaced priorities, we sometimes happen in this situation. Now, do you still think that physicians and other providers, you still think that they're still passionate about their love for medicine, right? And also, is there a way that we can restore this?
I do believe it's true. I think there needs to be some major changes overall, I think, in the way that healthcare is approached, especially here in our country. What's happened, I would say, over the past 30, 40 years is that the technology and the complexity of medicine has skyrocketed. And the way that we train physicians and the way that we conduct healthcare has really not changed that much. So the business of healthcare, the technology, the research, the expansion of medical knowledge has taken off. And yet we still have the same healthcare personnel handling all of that increased workload. So for me, the real answer is to work in teams and to have more professions that are in healthcare and to have people who are dealing with things that may not at the first glance involve health. But the reality is economics and community development and jobs and family supports all contribute to health. And so working in teams together, we can divide and conquer. All of this information and complexity cannot be handled by one person who is seeing patients. Just because there's a computer screen that contains all this information doesn't mean one person is the one to have to handle it all. So what used to be done by a nurse and a doctor together working to see patients, now for me, requires someone that is an expert in billing and insurance, another person who is an expert in computer technology, another person who's an expert in social work, another person who can work alongside of the physician as a community health worker, and all of these people working together to take care of patients and to take care of healthcare as a team, so that one person doesn't feel overwhelmed by everything.
All right. Now, that's some work that we got to do, but I think it's very important for us to address this important situation that is in hand, talking about this burnout and how to restore it. Now, talking about the culture of medicine, how has the culture of medicine contributed to so much disillusionment among doctors?
Well, in general, medicine tends to attract people who are invested in trying to make a difference in the world. They're invested in trying to help other people. They're invested in trying to find a career or a profession that brings them validation, that their hard work can somehow be rewarded by being affirmed and validated for what they do. And then we go into a system that's very hierarchical. And so we learn how to perform and to work very hard, long hours, study hard. And we also learn how to please those people who are in charge of training us. So this idea of the culture of self-sacrifice, put your head down and keep working, don't let your emotions get in the way of your work, and kind of just do what you're told, and you will get positive rewards as a result. That's taken into our practices after our training. And the problem is that there's no finish line anymore. We used to have the finish line of graduation from medical school, finding a residency, finishing residency, all these different finish lines. And now we are faced with this overwhelming amount of work to do, especially the administrative work. And our culture tells us, work harder, put the patient first. It must be something wrong with you that's not working. So you just must work harder to make it work better. And so this type of culture that continues to seek that external affirmation by working harder and being self-sacrificing has us kind of bury who we truly are authentically, what really brings us joy and what brings us life. And what we've done is we've traded that for this external script of what it means to be successful in medicine. But when we are set up in systems that don't support us, and we feel like we can just keep working harder to make it better, then we go downhill.
Absolutely. Thank you, Sherman, for your thoughts on today's topic of discussion. Talking about COVID-19, that it's the world in 2020. We know it has brought in a lot of changes to the world in general. So how do you see the experiences of physicians changing in the post-COVID-19 era going forward?
Well, I think there were several lessons that we learned from the pandemic. One is how poorly prepared we are from a public health perspective, as well as from a primary care perspective of taking care of patients and populations. And yet the other lesson that we learned is that we can be innovative and we can be creative at how to reach patients. So the whole idea of telehealth emerged and exploded during COVID-19. But what also happened with physicians as well as nurses and other health professionals is that we were called upon to work even harder and to put ourselves at risk, put our families at risk. We were called on to work at a pace and under conditions that caused even more stress than we were experiencing before. And we as physicians are humans. We were going through the same things everyone else was. We were locked down. Our families were locked down. Our kids were out of school. We had to find daycare. We had to figure all those things out too, while everyone else did. And we had to be out there and risk our own health and well-being by being exposed to the virus. So this caused a tremendous amount of trauma amongst health providers. As a result, we've come out of the pandemic, or we're still kind of on the verge of a pandemic. I would say not on the verge, but we're recovering from moving from pandemic to endemic. It seems like COVID is just a part of our reality now. And yet we're left with the aftermath of the trauma that we have all experienced as a society, and especially healthcare workers and teachers. I always relate healthcare workers and teachers as having gone through similar experiences. So now we're left on the other side, and our burnout is now manifesting as mental illness. Physicians are depressed, they're anxious. There is a mass exodus of health professionals, nurses, medical assistants, nursing assistants, physicians, PAs, everyone are leaving professions or looking for something else that enables them to have a better life balance. So this is a crisis that we're facing now, a crisis in the number of healthcare providers we will have in our future.
Great. Thank you once again, Joe Sherman, for that insight. Joe, do you have any exciting news you'd like to share with my audience?
Exciting news?
Yes. Or you have any projects in the pipeline?
Yeah, I would say there is hope through all of this. I really do think there's hope, because I think what's happening now is, as a result of what we've experienced, the trauma of COVID-19 kind of exacerbating the burnout that already existed, we have this opportunity for something called post-traumatic growth. It's where we've experienced this trauma, and then as a result, we start to reflect on where we are, how we do things. And if we were able in such a short period of time to transform health delivery and expand telehealth and to accelerate the technology of producing vaccines, then we also have the ability to transform the way we deliver healthcare. We have the ability to transform how we treat physicians and other healthcare providers. We have the ability to sit back and to say, what makes sense as far as workload is concerned for physicians these days? What makes sense as far as supporting physicians and health providers in the workplace, of giving them breaks, giving them a chance to share their experiences, giving them a chance to have extra time to do the administrative tasks we're required to do, giving them the support necessary of other people that do these administrative tasks better than physicians do. So I do believe that we're in this period that we have a choice to move in the road of post-traumatic growth as opposed to post-traumatic stress.
Right. Joe, my audience would like to get to know much about you and what you've been up to. Can you provide your website and your social media handles, if any?
Sure. You can find out a lot more about me on my website. It is joeshermanmd.com. It's my name, joeshermanmd.com. And there's a lot about my background. There are my services. I do individual coaching for health professionals, regardless of what area of healthcare that you're in. This individual coaching has to do with trying to do career discernment, trying to decide which direction to take, trying to discover where you can find joy and fulfillment in your work. So I work individually. I work with medical teams that are either in a clinic, an office, or the hospital, to try to learn how to support each other through this. And I also run retreats for physicians who wish to get away and do some reflection on their own self-awareness and how understanding their core values can help them make good decisions about their lives and their careers.
Thank you once again for that explanation. I wish you all the best in the projects that you have, Sherman. And thank you for joining me once again. Really had the worthwhile having you share your expertise on physician burnout and also the impacts on patients going forward. Wish you all the best once again in all the projects you embark upon.
Thank you so much for having me.
All right. If you'd like to catch up with any missed episodes of Live Well by Omobola Stephen, you can do so on any course promotion platforms or podcast distribution platforms you bump into online and do an amazing time. You can also get to catch up with the missed episodes on my website, www.omobolastv.com. Get to know much about me and what I've been up to also. Till I come your way, I need you to stay safe with all my love. I talk to you soon.